So how do we measure ARDS? Yes, so you have to do the PF ratio. That's what's going to get you what you need. So what's the P?
O2.
Yeah, so the PaO2, where do I get that from?
The labs.
My ABG. So it's the partial pressure of oxygen. It's the amount of oxygen dissolved in the blood, straight up from the lab. And then what's the F?
FiO2.
FiO2. Okay. So what is your PF ratio right now? Give me some very easy to do numbers.
Is it like, it's above 300 hopefully.
Okay, good. So I draw blood gas on you right now, and your PaO2 is 100, and you're breathing?
28.
No.
Or 21.
21%, call it 0.2. What's your PF ratio?
500.
500. This is you chilling, having a beer. 500. Okay, yes. Now, I have a question for you. I have a patient who's on 100% FiO2, okay? So now they're on 100% FiO2, okay? And you get a blood gas, and you just look at the blood gas. You don't know this information. And the patient's PaO2 is 100. That's not good, right? But to the untrained eye, just looking at a blood gas, and you see PaO2 is 100, oh, that's the upper limit of normal. They're fine. That is why the PF ratio exists. Because what is their PF ratio? No, it's 100. Come on, you're better at math than that. Theirs is 100, okay? So now this is where the Berlin classification comes into play. Okay, so you said 300. I want to see somebody over 300. Over 300, I'm feeling pretty good about myself. Because once you hit that 300 number, 200 to 300 is considered mild ARDS. Then 100 to 200 is considered moderate. And then less than 100, we're in trouble, severe. So again, that's when you're maxing somebody out on their FiO2 and their PEEP, and you're in this range. You got to start thinking about those rescue maneuvers, such as what we talked about previously. Whether you want to prone this patient, or whether the end of the line is going to be you need to start calling your CT or vascular guys to cannulate this person for ECMO, okay? Because, oh, no one answered, what's the common one for the trauma patient for ARDS? I bruised my lungs really badly.
Pulmonary contusion.
Yeah, pulmonary contusions are a good one. So that's a lot of times in crush injuries. So someone gets crushed or ran over like by a car, and they have bad rib fractures, the whole nine. We do all the plating and fix them. But they're in bad ARDS because of their pulmonary contusions. And those tend to, quote, like blossom. So someone will come in, they're okay, but you look at their chest x-ray, and you're like, oh boy. And then you get their CT, oh boy. And then all of a sudden, they get tachypnic, hypoxic, and spiral down this respiratory failure pathway. But Berlin classification, PF ratio, super important because, again, you could have the same number and it could be dramatically a different situation. It could be you drinking a beer on the weekend versus maxed out on ventilator support in the ICU.